Good afternoon, everyone, and welcome to this webinar on managing health risks in the construction industry. My name is Ben Pollard, and I'll be looking after the technical aspects of this webinar today. So just to start, I wanted to open the session with a few points before I hand you over to our speaker. Firstly, on your screen, most likely located at the top left-hand side, you'll notice a small bar with some written options on them, namely chat and Q&A. If you have any technical issues during this session, then please message me using the chat option. If you have any questions for our speaker, Mike, then please use the Q&A option, and we'll be able to answer any questions as they come through. It's worth pointing out that both of your chat and Q&A boxes will not automatically open when you receive a message, but will flash orange if something does come through. So you will have the option to open the chat and Q&A boxes and leave them open, but obviously you're also able to minimize them at your leisure to avoid you missing out on any of the presentation content. I'm pleased to welcome Mike Slater, who is your speaker today, a past president of BOHS and a chartered occupational hygienist with almost 40 years of experience working in occupational hygiene. Mike has kindly joined us today to speak on the problem of respiratory disease amongst construction workers, and in particular, how it can be prevented. So, without further ado, I'd like to hand you over to Mike and hope that you all enjoy the session. Okay, over to you, Mike.
Okay, well, thanks very much, Ben. I'm very pleased to be able to present this webinar here today. As Ben said, I'm an occupational hygienist. It's quite frightening to hear how long I've actually been doing the job, but there you go. I want to make this as interactive as we can, so we've got a few polls that we'll be running during the webinar. I think that's a little experimental for under this new Zoom system for IOSH, so hopefully all will go well with that. If not, just bear with us. Also, try and leave some time at the end to take questions. But if you've got a burning question as we're going along, if you type it into the Q&A box, I'll try and keep my eye on that and see if we can answer it as we go along. If I feel it's more appropriate to answer it at the end, I'll do that instead. Okay, so let's kick off. So as it says on the screen here, what I want to talk about today is about managing health risks in the construction industry. The reason why we're doing that, I guess, is we'll see in a moment, health issues are a big problem in the construction industry. And BOHS, the British Occupational Hygiene Society, is currently running a campaign in conjunction with a number of partners from the industry to raise awareness about the problems and solutions specifically relating to respiratory health in the construction industry. Anyway, we'll kick off with the first poll, in fact. So Ben, if you can activate that for us. What I'd like you to think about is how many construction workers died last year as a result of an accident at work. So let's see what you think on that one. So we'll just give you a moment or two to vote, and hopefully we'll see some results very shortly.
We're just waiting on a few more votes to come through. We'll give it another 5 seconds, and then we'll end the polls.
Okay, so we've got some varied answers there. Majority have gone for 35, some 135. And one or two gone for quite a large number there, 3,500. So if we close that, Ben, please. Okay, well, let's have a look at what the picture is in terms of deaths due to accidents at work. And according to the HSE's figures, that was actually 35 people. So the majority went for that. That's the official statistic. I think that's probably pretty accurate, because when somebody dies at work, it's very difficult not to know about it when, unfortunately, we've got a dead body in front of us. So 35 people it is. So let's move on. This session is actually about health. So we'll move on to the second poll, really, and let's compare that with what you feel is the figure for the number of construction workers who died last year due to ill health caused by their work. So again, Ben, if you can launch the second poll. I can't see anything appearing, Ben. Is it? Are we still there, Ben? We seem to have had a problem with this second poll, so I think what I'll have to do is move on.
Well, Mike.
Yeah.
These polls are up for people to see. It might be that it's not showing on your screen.
Right.
Would you like me to tell you what the answers were, so you can get an idea?
I think that's the best approach then. So
okay, not a problem. Well, in that case, 8% of people selected 50. 24% selected 150. 33% selected 500, and just slightly topping it with 35% people selected 5,000.
Okay, so a range of results there. So let's have a look at the next slide. Well, this isn't for the total number of people who died from occupational health in the construction industry. It's just looking at one disease, which is occupational cancer. And we can see from that slide that according to the best estimate we have, about 3,700 construction workers or ex-construction workers died from occupational cancer last year. That's almost 50% of all occupational cancer cases, even though the construction industry certainly isn't 50% of the workforce. It's very difficult to actually get statistics on occupational disease, particularly diseases like cancer and silicosis, which are two of the main concerns for that can lead to death for construction workers. The long latency period, the time it takes to develop the disease after exposure, means it's difficult to get the statistics. But as we can see, it's a lot more just from cancer alone. It's a lot more than the number of deaths from accidents at work. So I reckon probably the best answer to that question is about 5,000, although that's going to be very approximate if we consider other diseases besides cancer. So probably about 5,000 people in the construction industry or ex-construction workers died from occupational disease as a result of their work, and that's considerably more than have died from accidents at work. And this slide really is one that we've used in BOHS to illustrate the relative numbers for industry generally, and I think it's certainly applicable to the construction industry as well, that at less than 1% of deaths in the construction industry are related to safety compared to health issues. So health dominates, yet if we look at what the industry has done in relation to managing health and safety, the effort has really been placed on traditionally on safety. I mean, that's understandable. Construction is a dangerous industry, and if we go back not that many years, the number of deaths is considerably more than 35 due to accidents. So the industry's done a lot of good work in terms of reducing fatalities and injuries, but there's a lot of work to do now, I feel, on health. And as Steve Hales has said, the industry has whispered health and shouted safety, and that perhaps we now need to make a little bit more noise about the health issues in the construction industry. This is a typical construction activity that could lead to health effects. Dust containing crystalline silica, respirable crystalline silica, that can lead to silicosis and cancer. But it's not just about fatalities, it's also about conditions that can affect your life. So this type of work also presents other problems, like other health problems like noise, vibration and ergonomics, clear risk here, poor posture, etc. Now, there are, however, solutions available to many of the problems that we can see in the industry. And one of the ways we can deal with the dust here is to use water suppression. So Ben, again, next poll, could you activate that, please? And
not a problem. Right, okay, that's been activated. So
okay.
we'll allow everyone to a bit of time just to select their answers.
I think we'll have to do the same as last time, Belle. Once you've closed it, let me know what the results were, because I can't see them on the screen, unfortunately.
Yes, I will do. I'm not quite sure why it's not appearing on yours, because I can see that it is appearing on every participant's screen. It's a strange one. Okay, we've nearly had everyone now. We're just waiting on a few more, so I'll give it another 5 seconds. Okay, right, I'll share these results then. I don't know whether you can now see that, Mike, or not. No, okay, that's not a problem. So 4% of people thought that it was 10%. 7% of people thought it was 25%. 29% of people thought it was 99%, but the largest amount of 60% of people said that they thought it was 75%.
Okay, thanks for that, Ben. So let's have a look. Well, according to a study that was done a number of years ago, 99% was the answer. I'm a little bit skeptical on that, and I think if I'd have been voting on this, I'd have probably gone for 75%, like the majority of people, because these were laboratory tests after all, and so I think that's probably the best answer. But water suppression can be effective. That actually doesn't mean to say that that would bring it below the exposure limit for crystalline silica, for example. The exposure limit is very low, and the amount of dust generated by these activities is very high, and even 75 to 90% reduction in total dust levels may still lead to silica limits being exceeded, but water suppression can be very effective. Another solution is available, which is to use extraction built into the angle grinder, and again, some studies have shown that they can be up to 99% effective. So in other words, there are actually solutions available that can deal with that problem, and exposure to silica is one of the big issues in relation to the construction industry, but there are solutions available. There's a problem, many solutions are actually available, but they're not always being used. So it's as a result of this that we actually launched the Breathe Freely initiative last year on Workers' Memorial Day, over 12 months ago now. And the intention of that campaign is to do a couple of things, which we'll look at in a moment. But the initiative was launched in conjunction with a number of partners, HSE, Land Securities, who were a big landlord, Mace, a big construction company, and Constructing Better Health. And that was launched in London at the Merchant Taylors Hall. And we had some senior people from the construction industry. I don't know if anybody attending this webinar today was there. You may have been. And since then, we've signed up as supporters. At the moment, it stands at 160 different organisations. These are just a small proportion of them who've signed up to say that they're committed to the objectives of Breathe Freely and want to see a reduction in respiratory disease in the industry. And the objectives of the campaign are twofold, really. One is to raise awareness of the problem, but not only to raise awareness of the problem, also to raise awareness of the fact that there are many solutions available to many of these problems. So raising awareness on problems and raising awareness on solutions. And the second thing we've attempted to do is to provide tools and resources that managers responsible for health and safety and others trying to reduce the risks can utilise. In terms of raising awareness, we've organised a number of meetings around the country. Again, some of you may have attended some of them. As you can see, these are where we've held them. There's been 7 roadshows held, average attendance about 100 people at each one of those, and not just speaking to the converted. We've worked with our partners and sponsors on this and use their databases, customer databases for Speedy, RVT and Arco to get bums on seats, and people who are not necessarily fully aware of the issues until they've been to the meeting have attended. And besides these roadshows, we've also had speakers at a wide range of meetings to try and get the message across. So we feel we've had some success in a small way at raising awareness. And it's also been good to see that the industry is waking up more and more to the need to manage health, and we've seen the launch last year of the Health and Construction Leadership Group, which again I'm sure you're all aware of, which is again trying to work on this issue of health. And BOHS, like IOSH and many other organisations, are working closely with that group. Anyway, let's have a look at management of health. And it's good to see that the industry is starting to wake up to the need for health. A number of major companies have shown a commitment to that. Some companies have even started to employ occupational hygienists. Balfour Beatty, for example, recently took on a group occupational hygienist to provide support. But most organisations, however, when they think about health, they tend to think about nurses and doctors and think that health is about nurses and doctors. Well, quite clearly it is. They have a role to play in health. But what we want to do is make sure that people are reducing the risk and not simply treating the symptoms. So there is a document that was produced by Cognac in conjunction with IOSH that was launched last year. At the risk of being a little bit controversial, unfortunately, I think that document has missed some important points, that it very much concentrates on the medical side of managing health in the construction industry. What you tend to see is companies, when they start to address health, they'll often think about two major elements of health risk management, and that's well-being and health surveillance. Well-being, which is about getting your workers fit; health surveillance, which is looking for ill health problems. Unfortunately, what tends to get forgotten is the bit that's really the most important bit, which is actually the things that companies should be doing to manage the risk and find ways of preventing the risk and controlling them. That's really the key to effective health risk management. Well-being, it's a good thing, no question about it. It's about encouraging workers to be fit and well. And you can sort of understand why companies do that. First of all, it looks good. They seem to be doing something beneficial for their employees. And that's not a bad thing. And also from a company perspective, well, they want the workers to be fit so they can do the job. So there is very much a payback that the companies can see by investing in well-being schemes, because they want the workers to be fit in order to do the job. Health surveillance, again, that's a very visible thing that companies can do. But what does health surveillance do? Well, if it's being done correctly, then it's about detecting ill health at an early stage, and then to try and treat symptoms where that's possible. Although with things like cancer and silicosis, there's not really a lot you can do about treating it. So it's really about detecting ill health. But there's very little point in having workers who are fit coming to work if then you're going to expose them to risks at work that aren't adequately controlled. And those risks then lead to them becoming ill. What you can guarantee then is that you will be detecting symptoms in the health surveillance. So the real key to effective health risk management is to manage the risks, not to manage the symptoms. However, I'm not saying that well-being and health surveillance aren't important. They are. They're part of an effective management strategy for managing the health risks at work. Well-being ensures your workers are fit. Health surveillance helps to detect problems, but the key is to ensure that we're dealing with the things that can cause the problems. They're the things that the employer is, they're the risks that the employer is creating through their work, and they're the things that employers need to manage. So the real key thing that needs to be done is to ensure that we've got effective risk management programs in place. Without them, the well-being and the health surveillance will not have the benefits that they should have. So that's the real key to health risk management. But, as I said, the other two elements are important as well. And getting an integrated approach, which includes well-being and health surveillance along with health risk management, will lead to an effective management program. There is a model to how this can be achieved. I'm sure you're all familiar with the work that was done in during the construction of the Olympic Park. I mean, that's a long time ago now. We just completed the Rio Olympics. Excuse me, just a little frog in the throat. And there's been a number of studies published on the work that was done during the Olympic Park construction. And an important part of that was managing the health risks as well as managing safety effectively. And in that health risk management, the prime focus was about prevention, and they employed occupational hygienists as part of the team, as well as having medical support, and had a good balance between the three key elements, that is well-being, risk prevention and health surveillance. So how do we effectively manage health risks in the construction industry? Well, the first thing is to ensure that management are on board. We've really got to start at the top. So there's a need to build the business case to convince the senior management that they need to do something. That isn't always easy. With safety issues, the problems are immediate. And if we do something about them, the payback is short term. But when we're looking at health issues, the long term, cancer can take 30 to 40 years to develop. The people may no longer be working for the company. Similarly with silicosis and other non-fatal conditions like noise-induced deafness and hand-arm vibration syndrome. They take a long time to develop. People will have moved on. So it can be difficult to make a financial case, although there is one. There is a financial case. There are benefits financially to the business. So we have to look at other elements as well in terms of convincing management. And the things we've identified in the Breathe Freely campaign are the other aspects that need to be considered. Obviously, ensuring good employee relations. There's a social and legal responsibility as well. And I think very important to the construction industry is having a good reputation. So there's a reputational issue, and I think that's a strong element to building the business case. So building a business case is really the starting point, ensuring that the senior management are on board. And as I said before, earlier on, it's good to see that a number of major companies, the senior management have bought into this. And the key is to manage health just in the same way as we manage safety, to give it the same sort of profile and adopt the same types of approaches. So it isn't rocket science, really. Okay, well, I've been talking for a while now, so time for another poll. So let's see within your own organisation whether that's the case. Do you manage health like safety in your organisation? Be honest about it, because it's good to get a picture of how organisations are doing on this. So Ben, can you launch the next poll for us, please?
Yep, not a problem. That's been launched. So we're just waiting for the votes to come in now.
Now, somebody's asked a question about explain the financial business case with some examples. That's not an easy question to answer, and certainly in the time available, I really can't do that. If you look at the stuff from that's been published on the Olympic Park, there's some good examples there. There's probably not many more around specifically from the construction industry. If you do go on the Breathe Freely website, you'll find that there's a section there on the business case, and again with some examples on there. So perhaps you'd like to visit the www.breathefreely.org.uk, and you'll find some information there. Okay, Ben, have we got some answers on that? It's actually showing up the results for me now. So what I can see here is, and it looks like people are being honest, which is great. 4% of people feel that their companies are leading on this, which is good to see. As we perhaps expect, a lot of people are in the middle. And about 20% of organisations represented today and not treating health like safety, which really shows, I think, what we suspected, that there is still a lot of work to do on this. So thanks very much for being honest about that. And the second key point is that we need to manage the risk and not the symptoms. So the priority, the first priority is really about managing the problems that the job creates, managing the work, managing the risks that are created by the work. So the next poll is really asking on that. So again, be honest about it. Is priority in your organisation given to risk prevention rather than well-being and health surveillance? So can you launch the poll, please, Ben?
Yep, the poll has been launched. We're still waiting on a few, so we'll just give it another 10 seconds or so.
Okay, there was another question regarding the Steve Hales quote. Steve's used that quite a lot at a number of meetings I've attended, and there's it's been mentioned in a few articles as well. So I can't, off the top of my head, give you a reference, but I can. If you contact me, whoever asked that question after the webinar, I can provide a reference to that for you. Okay, have we got some answers?
Yeah, the majority of them. I'll share the results now.
Okay, I can see the results again, Ben.
Great.
Okay, so again, a mixed picture, and with the middle being mainly represented, and a small proportion is the organisations not giving the priority to prevention. Others, at least to some extent, and that's good to see that in the organisations represented today, that you know, we've got some priority being given to managing risks. Okay, good. Let's move on. So, as we said, it's about a balance. The risk prevention's the primary thing you've got to get right. If you don't get that right, there's no point in having well-being programs that out-tech fit workers and make them ill, and then detecting them illnesses by health surveillance. The three things really have got to go together. Okay, so one of the things we found when BOHS were building the campaign was that a lot of companies who wanted to take health seriously weren't sure about how to go about doing it. One of the questions we kept getting asked was, well, what does good look like? So one of the things we've tried to do is you know, give some benchmarking for people, so they've got more awareness to the sort of things that they can do. And one of the things we did was produce the high management standard, which is sets out the key things that companies need to do if they're going to manage health effectively. Now, this isn't rocket science to anybody who's in health and safety. As we said, manage health like safety. So not surprisingly, the headlines, if you like, are the same as the sort of things that we would need to do if we want to manage safety effectively. So ensuring we've got leadership and commitment, carrying out risk assessment to ensure we understand what our risks are, then deciding on what controls we need, planning to prevent ill health and to implement the controls, manage the program effectively, and then ensure that the people involved in all of these things are competent, and that workers are also competent and have got appropriate training and exhibit appropriate behaviours. There's nothing new in that. It's the same as if we want to manage safety effectively. But what we try to do is to put that in terms of what that means in terms of health management. So for each of those key elements, got a number of sub-elements that they illustrate what you need to do if you're managing health effectively. Now, this is aimed at smaller companies in particular, and we've taken as a model something that industry's familiar with. I'm sure you're all familiar with the Considerate Constructors scheme. Every construction site I walk past, I can't help but notice these days the sign, or several signs quite often, proclaiming that they're considerate constructors. And the Considerate Constructors schemes had a lot of traction in the industry. In fact, I'll be attending on Thursday this week the conference run by Considerate Constructors to talk about Breathe Freely. So it's a relatively simple approach where they set down key objectives, and they have a scheme which allows the companies to benchmark themselves. And we've sort of modelled a self-assessment scheme for the high standard, very much on the approach taken by the Considerate Constructors scheme. So if I can just perhaps show a few points about that. So one difference is that we put a score on that helps companies to see where they stand and where the strengths and weaknesses are for each of the elements. As it stands at the moment, we have it's for self-assessment, so companies can do it themselves to decide where they stand. Of course, they need to be honest about it. If they're not, then there's very little benefit in doing that. We hope in the future to have an independent assessor scheme similar to what they have for the Considerate Constructors. So then there's no problem with people not being honest or not understanding what other people are doing, and so they can benchmark properly. So for each of the key elements in the high standard, we've got a series of simple questions that companies can ask themselves, and with examples of sort of evidence that would show show that the companies are doing and complying with those requirements. So there's the one for leadership and commitment. The idea is that they give a score very similar to the scores I used on the last two polls. And similarly for other elements, planning and prevention, and for risk assessment. We've also backed these up with other resources. As I mentioned, one of the key objectives of the Breathe Freely campaign is to provide tools and resources to help people to do the things they need to do. One of the things we found is that COSH assessments are very poorly done in the industry. In most cases, smaller companies in particular don't really understand what they need to do, and sadly some big companies as well. COSH is not about assessing substances, it's about assessing risks from substances, yet most companies seem to feel that what they need to do is gather suppliers' data sheets and that's all they need to do. Well, that's quite clearly not the case. So we've provided some simple guidance on the sort of things that need to be done to do an effective risk assessment, COSH risk assessment. Other things like controls and competency training and behaviour, and then the program management. So the idea at the end of that, when the companies go through the self-assessment, they can then decide where the strengths and weaknesses are, and then they can then develop an action plan to try and address some of those weaknesses, or indeed look for where else they can improve. So that's the idea of it, is to help companies move forward, continual improvement, and ultimately reduce the risks to the health of the workforce. So that's actually going through some pilots at the moment. If anybody thinks it might be useful, it can be downloaded from the Breathe Freely website. And we're very keen to get some feedback. It's very much a first draft at the moment, and things come out in the wash, as they say, so we're certainly keen to get any feedback so we can then improve on the standard in the future. So hopefully that will help smaller companies in particular to start to think about how they're managing the health risks that the workers are exposed to. And this information is available on the Breathe Freely website. And if I could just perhaps tell you about a few other resources that we have available that can help companies, may even help yourselves to have a look at some of the materials, that we've produced. All available through the Breathe Freely website. So one of the things we've done for the 20 key construction trades is to produce some simple fact sheets, 2 sides, listing the hazards and risks common to that trade, the sort of control options that are available, and the other sort of things that companies need to do to manage the risks. There's also some case studies, and we're keen to develop more case studies. So if your organisation has anything that you think other people can learn from, here's a way of getting that information out to other organisations. So for example, here's one from Crossrail about controlling silica exposure during the spraying of concrete. We've also developed what we call the Construction Managers Toolkit. So that's a number of resources that managers can use to help manage the risks and get the message across to the workforce. So that includes the IOSH guidance. There's also a health risk checklist that can be used during site inspections. There's some visual standards that, as I said, a lot of companies ask us, what does good look like? So there are examples of what good looks like for particular risks. And then a series of toolbox talks, because what's important is that these messages get down to the workforce as well. We've also developed some guidance on RPE use in construction. Initially, we've launched a simple guidance on using respirators where people have got facial hair. This was a question that continually came up on during the roadshows that we've organised. A lot of companies don't want to bite the bullet of saying you either are clean shaven or you can't wear a tight fitting respirator, so we've produced some guidance specifically on that, and we're currently working along with the International Society for Respiratory Protection on some more detailed guidance on how to manage the respiratory protection specifically on construction sites. There's a lot of good guidance from HSE on RPE management, but we want to make this specific to construction because there are particular problems of how to manage it on sites, on construction sites. And coming early next year is the BOHS certificate in controlling health risks in construction. That will be complementary in many ways to the IOSH Construction certificate. This will be a one-day course focusing on the key health risks in construction and how to control them, and that's being developed with a number of key stakeholders from the industry, with the intention to launch in January next year. The stakeholders told us they needed this, and so we went and ahead and in conjunction with them developing the course. So that's a little bit about managing health in construction and the sort of things that BOHS and Breathe Freely have been doing. So we can open up for questions now. You'll need to type them in the Q&A box. there's some questions already in there. They're not easy ones to answer. So the first one from Mr. Anonymous Viewer, or Miss Anonymous Viewer. How do you get your employees to buy into health and wellbeing culture, as we find it difficult to get employees to respond to any new initiatives? Well, I can understand that. It's never easy. Health and safety these days has got we've always got health and safety. We've always got that barrier to overcome, haven't we? It's really about continuing to get the message as best you can across to the workers using initiatives. There are examples of where companies have done that, organisations have done that. Again, the Olympic Park, Crossrail, a few other big organisations. And it isn't easy, but you've just got to keep chipping away. Probably not a very satisfactory answer, but it's difficult in a short period of time. I'll come back to Ershad's question in a minute. I'll just deal with some of these shorter ones. So Joe is asking, can the certificate be taken in Gibraltar? That's an interesting one. I don't see why not, providing you've got an approved provider. What will happen will be organisations will be to apply to be an approved provider to deliver the course. That allows some quality control. But there's no reason why that couldn't be taken in Gibraltar if you've got a provider over there. There's even a possibility of looking at doing it, making this available over the internet as well. Will the slides be made available? I think Ben can answer that one for me, but I presume that's I'm very happy to release these. I will also be putting them up on my SlideShare site, which is www.slideshare.net/Mike Slater, all one word.
I just say that as long as you're obviously happy to authorise it, yes, these slides can be put. They'll be put on the Construction Group's microsite along with a recording of this webinar as well for everyone to download afterward. They'll probably appear. They'll appear on the website. It won't probably now be until next week, because unfortunately we are going through an upgrade on our web development system, but they will certainly be up and running from next week, and I'll also email everyone copies of everything at some point tomorrow.
Okay, so there'll be a number of ways you can get access to those. Okay, another one from another anonymous viewer, or the same one, who's asking a lot of questions. Can a job be safe while being unhealthy? Well, the two things do go together, don't they? I mean, many jobs that present, many activities that present safety hazards also present health hazards. And the thing is that the safety hazards are much more obvious and much more immediate, and perhaps easier to deal with and easier to convince management to do something about them. It's much more difficult to convince people to management to pay attention to those health risks, as we've discussed before. And in fact, Ershad's question is about that, is that how do we convince companies in terms of cost benefit? Well, that's difficult. It's not easy, and because the benefits are long-term rather than short-term, and in fact some of the benefits which are more to the individual than the organisation when you're looking at workers who may have retired or have moved on to other companies. So it isn't easy to convince. So I think we could have a full webinar on that, Shad, and it's not easy to give a short answer to that now. So not a satisfactory answer, I know, but it isn't easy to give a short answer to that question. So somebody was asking about the resources Well, the resources on the Breathe Freely website are completely free. They've been produced on a voluntary basis by occupational hygienists and others who've given the time free, because we're all passionate about getting this message across. So the resources are free. As for the trainer course, nothing's planned at the moment, but we listen to stakeholders, and if there's a demand for that, then we could look towards perhaps doing something. Okay, so Urshad's commented he appreciates that it isn't easy, and it is something we need to do more work on. I absolutely agree with you on that one, that there's more work to do to convince management. But you start small, big oaks from small acorns, as they say, and I think if we go back 2 or 3 years, there was less commitment on this, and we're now seeing more companies being prepared to be committed on this. Another question, will Breathe Freely Roadshow be coming to Northern Ireland? Well, the answer to that is yes. We're currently planning 2 more roadshows, another one in London, which is going to be held in early November, and we're currently beginning to organise a meeting in Northern Ireland as well. The date's not set for that yet. We're currently talking to potential sponsors, so it'll either be towards the end of this year or early next year, I'm glad to say. Okay, have we got any other questions?
No, it looks as though that appears to be it. There's nothing else in the chat box or anything, and there aren't any more outstanding in the Q&A box. So unless anyone else does have any burning questions they want to put through, now we do have a bit of time for answers, but obviously if everyone is done asking questions, then in theory we can close the session a bit early. But what we'll do is we'll just perhaps maybe leave it for a minute or so, just in case people are still typing. If they do have a question, we'll answer it. But otherwise, we'll assume that in a minute or so that the session can be brought to an end.
Okay. Well, I'm happy if anybody wants to follow up on this. I'm happy to take any emails, and if anybody's interested in getting involved with the Breathe Freely initiative, again, just contact us, and we're very happy to get more people involved. We need to do that, and if you've got suggestions in terms of what other things we can be doing to help you, what other resources will be helpful, then we're interested to know. Can't promise that we'll do everything, because we have got limited resource to produce the materials, but we do try and listen to stakeholders and produce the sort of things they need to help them to do their job.
Okay, great. Well, it looks as though there aren't any more questions that are coming in. So on that basis, I'll assume that the session can now be ended. Just to thank you, obviously, thanks Mike for taking out the time to come and talk to us today and deliver this session. As I mentioned to everyone, that the session is being recorded at the moment. So what will happen now is I will save a copy of this recording, which will go on the Construction Group's microsite. It will also go on the IOSH's YouTube channel at some point in the near future. We will PDF the presentation, and that will also be included. So you will receive an email from me at some point tomorrow, and I'll be able to supply you with all the necessary information when I drop my email across to you all. But if everyone else, if no one else has got any questions, we can call it a day there. And once again, thank you, Mike, for delivering a thoroughly enjoyable presentation.
And thanks very much for the invite and the opportunity to talk today. Thank you.
Not a problem. What I'll do is I'll leave the session open. We can just mute ourselves, but I'll leave the session open in case anyone has any last minute comments they want to make that we can look at afterwards. Otherwise, I will close the session in approximately a minute or so. Okay then, thank you everyone, and bye-bye.